this lesson, we will discuss several medical conditions that are either related to or commonly occur with Chiari, including migraines, Syringomyelia, Ehlers-Danlos syndrome or EDS, idiopathic intracranial hypertension or IIH, and hydrocephalus. According to the Chiari 1000, nearly 2/3 of Chiari patients, including adults and children and both female and male, have also been diagnosed as suffering from migraines. Migraines are defined as severe throbbing pain or a pulsing sensation, usually on one side of the head, and often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. Migraine attacks can last for hours or even days, and the pain can be extreme. Although migraines affect more than 10% of the general population, they are poorly understood, and the migraine-Chiari connection, if there is one, has received essentially no research attention. It is not known if Chiari also causes migraines in some people, if migraine sufferers are more susceptible to developing Chiari, or if there is some other type of link between the two. What is known is that a large portion of Chiari patients, especially women, not only get the classic Valsalva-type Chiari headache, but they also suffer from classic migraines as well, which don't respond as well to surgery. One of the most serious conditions related to Chiari is Syringomyelia. Syringomyelia refers to the development of a fluid-filled cyst or syrinx inside the tissue of the spinal cord. Over time, a syrinx can expand and put tremendous pressure on and damage the nerve roots in the cord. Estimates for how often syrinxes occur vary widely in the literature, but data from the Chiari 1000 indicates that 20% of Chiari patients also have a syrinx. With Chiari, syrinxes most often occur near the top of the spine, but can also occur lower down. The nerve damage can cause loss of sensation and weakness in the arms, legs, hands, and feet, inability to regulate body temperature, and bladder and bowel problems. Pain in the neck, arms, upper back, and shoulders is very common and is referred to as the cape effect of Syringomyelia. As a syrinx expands, it can cause permanent nerve damage and even lead to paralysis. Although there are several theories, how and why syrinxes form is poorly understood, and there is currently no way to predict who will develop a syrinx. In terms of treatment, the presence of a syrinx is a strong indicator for surgery, and a reduction in syrinx size is a key marker of a successful decompression. Unfortunately, patients with a syrinx tend to have poorer outcomes, especially if they have been symptomatic for a long period of time. Ehlers-Danlos syndrome, simply known as EDS, are a group of inherited connective tissue disorders. Connective tissue provides structure for the human body and support for its internal components. Disorders involving connective tissue, such as EDS, can lead to problems with joint hypermobility, joint dislocations, fragile skin, poor wound healing, and vascular and heart problems. While there are a growing number of recognized types of EDS, the one associated with Chiari is hypermobile. Unlike other EDS types which have a recognized genetic mutation, the underlying genetic cause of HEDS is not known, and therefore it is diagnosed based on symptoms including joint hypermobility plus the presence of other indicators. Independent of Chiari, EDS can cause debilitating pain, fatigue, and headaches with no effective treatment options. Research indicates that 9 to 12% of Chiari patients also have hypermobile EDS, the overwhelming majority of whom are female. However, because EDS diagnosis is difficult, the actual number may be higher. In terms of treatment, EDS often leads to cervical instability, which requires stabilization during Chiari decompression. Unfortunately, in terms of outcomes, this subset of patients will often continue to suffer from many problems associated with EDS even after decompression surgery. There is also an overlap between EDS and postural orthostatic tachycardia syndrome, or POTS. According to Dysautonomia International, POTS is defined as a change in heart rate of a certain value after standing up from a prone position. However, this clinical definition doesn't do justice to the effect that POTS can have on people. In fact, it has been estimated that the quality of life in POTS patients is comparable to those on dialysis for kidney failure, and between 1/3 and 1/2 of Chiari patients with EDS may also suffer from POTS. Idiopathic intracranial hypertension, also known as pseudotumor cerebri, is a condition characterized by an increase in intracranial pressure, the pressure of spinal fluid in the head, with no apparent cause. The increased pressure causes headaches, visual issues, nausea, and ringing in the ears. If left untreated, it can lead to permanent vision problems due to swelling of the optic nerve. Among adults, it affects primarily women, and BMI appears to play a strong role. with one study finding 80% of adult women with the condition were obese. Treatment can include drugs to lower the intracranial pressure and/or the surgical placement of a shunt. Data from the Chiari 1000 indicates that 8% of Chiari patients have also been diagnosed with intracranial hypertension. Currently, it is not known if one condition causes the other, if they both share a common underlying cause, or if patients with both are a statistical coincidence. Diagnostically, the condition can create a problem because of the symptom overlap with Chiari. This is likely the cause for some surgical failures where patients experience a temporary relief only for symptoms to return in a couple of months. At that point, an additional procedure is likely needed to insert a shunt to control the elevated pressure. Hydrocephalus is an abnormal accumulation of cerebrospinal fluid in the ventricles of the brain. Over time, the ventricles expand and put pressure on the brain tissue, causing symptoms such as headaches, nausea, tiredness, and loss of balance. While it is commonly seen with Chiari 2, it is also present in about 5 to 10% of Chiari 1 cases. Hydrocephalus is thought to arise from an imbalance in the production and absorption of CSF, often due to obstruction in the natural flow of the fluid. As with other conditions, the link between hydrocephalus and Chiari 1 has not been fully worked out. It is possible that the increased pressure associated with hydrocephalus can push out the cerebellar tonsils, but it is also possible that both conditions arise from the same underlying cause. Complicating matters is the fact that hydrocephalus can develop after Chiari decompression surgery. Hydrocephalus is usually treated surgically, often by placing a shunt to divert and drain the excess fluid. For patients, having a permanent shunt can be problematic, as shunts can get infected and malfunction, necessitating additional procedures. Also, shunts placed in a young child may need to be replaced as the child grows. When hydrocephalus is found with Chiari at the time of diagnosis, the hydrocephalus is usually treated first. Research has shown that Chiari symptoms improved nearly 80% of the time in cases such as these, and additional Chiari surgery was only required about 10% of the time. When hydrocephalus develops after Chiari decompression, most cases will require the placement of a permanent shunt, but some people do improve with temporary diversion of the excess fluid. To summarize, Chiari patients sometimes suffer from one or more additional health conditions whose symptoms often overlap with Chiari symptoms. 2/3 of Chiari patients also experience migraines. Syringomyelia is when spinal fluid collects inside the tissue of the spinal cord, damaging nerves, weakening muscles, and potentially leading to paralysis. Hypermobile Ehlers-Danlos syndrome is a heritable connective tissue disorder which can lead to cervical instability and postural orthostatic tachycardia syndrome. Idiopathic intracranial hypertension, also known as pseudotumor cerebri, is characterized by a continuous increase in the pressure of the fluid in the brain. It can be treated either through medication or by placing a permanent shunt into the brain. Hydrocephalus is when there is an abnormally large amount of fluid in the brain. It also can be treated by placing a permanent shunt in the brain to divert the extra fluid.